Well, just more than a year ago, medical professionals were trying to grasp how the COVID-19 pandemic would evolve as hospitalizations began to surge. That was the beginning of vaccine rollouts and just ahead of a leveling out in cases. Of course, that leveling out would happen before we started to see a major spike in those cases.
It's just fascinating work what these people do. And in 2021, we spoke with these experts who watched the data to make the projections and predictions about what could happen next, specifically how many people could end up in hospitals locally with COVID. Now we're looking back more than a year later, and again we're looking forward, this time with more tools to fight the virus. Fox 8's Daryl Matthews spoke to those experts, joins us now live tonight from Greensboro. So Daryl, what are they saying?
They tell me even though we have more vaccines, we have approval for vaccines and booster shots, there are still some challenges to face before we see the end of this pandemic. One that data show is soon to come is a huge spike in COVID-related hospitalizations. 2 years into the battle, and it's starting to feel like deja vu when it comes to fighting COVID-19.
We do anticipate lots of hospitalizations and cases over the next 3 to 4 weeks. Really through January, and hopefully we'll see a peak, at least in the short term, and perhaps a decline in cases from that point forward.
Right now, Cone Health has 226 people hospitalized with COVID-19, only 64 fewer than this time last year, and experts say that number will only get bigger in the coming days.
We had anticipated that there would likely be a resurgence in the winter. We saw that based off of our vaccination coverage, and the number of susceptible in the population at the end of the Delta wave.
Michael DeWitt studies data for Cone Health. He says a combination of information from the State Department of Health and Human Services, the CDC, and calculations representing the spread of infection locally allows data scientists to see where this pandemic is heading.
Really, the struggle is we're giving SARS-CoV-2 a lot of hosts, a lot of people to experiment in. And until our vaccination coverage is high, both locally and across the world, we'll see a rapid rise of different variants.
As more variants continue to emerge, so does the guidance from experts on a federal level. A new advisory from the CDC this week now gives more parents the option to get booster shots for their kids.
We are seeing more children be hospitalized as the Omicron variant is the predominant variant in our community.
The recommendation is for kids 12 to 15 to get boosted with the Pfizer vaccine at least 5 months after the normal 2 doses.
Whenever we have more information is when we're able to move and change things. That's why we now have the approval for the booster for the 12-year-olds.
A key tool in slowing the spread of the virus and limiting hospitalizations.
For us to be able to beat COVID-19, or at least make it so it's not making people so sick and really overwhelming our health systems. And adding this booster to this younger age group is another way that we're doing that.
According to the CDC, about 5 million kids are able to get booster shots right now. And as you just heard Dr. Brooks, this is another way to slow the spread of the virus and get to the end of this pandemic, along with wearing a mask, social distancing, and washing your hands. We are live in Greensboro. Daryl Matthews, Fox 8 News.